Can you use tamoxifen for polycystic ovarian syndrome? Let's talk of ovulation induction. In PCOS, how do you achieve pregnancy? First step is to induce ovulation, produce one follicle or one egg. Now, three drugs have been typically used. Those are clomiphene, letrozole, and tamoxifen. Let's compare clomiphene and tamoxifen. Tamoxifen has been used for a long time in the past. And if you look at the effectiveness from ovulation and pregnancy rates, a study suggested in which 50 patients were treated with clomiphene, 37 experienced successful ovulation, giving an ovulation rate of 64% and a pregnancy rate of 32%. In that study, another group was of 41 patients ovulated on tamoxifen, indicating an ovulatory rate of 82%, and 18 women conceived, giving a pregnancy rate of 36%. So these findings are just from one paper. They suggested that because tamoxifen would spare the endometrium and not have a negative impact, it may have given a better chance of pregnancy. Now, several studies since then have been done and found that clomiphene and tamoxifen were equally effective in inducing ovulation and had approximately the same chances of pregnancy. The ovulatory rate was around 66.6% for tamoxifen and 70% for clomiphene. There have been other studies which have highlighted that tamoxifen may give a better chance of pregnancy, but these have not been extensive studies. Now, why is it that we don't use tamoxifen now? Is we used to use tamoxifen when the lining became thin on clomiphene. Now, as soon as we start having letrozole tended to give a better success rate. So the question is, can we still use tamoxifen? In some cases, on women who do not tolerate letrozole and who react badly to clomiphene, tamoxifen can be used. The benefit of tamoxifen, unlike clomiphene, is that it gives a better endometrial lining and blood flow compared to clomiphene. And thus, when compared to clomiphene, it may have a reasonable chance of pregnancy. Letrozole almost has replaced tamoxifen, and in many cases of polycystic ovarian syndrome may be a better drug than clomiphene.